This is Dr. Gil Wilshire at Missouri Fertility. Today, I'd like to discuss fertility treatment during the time of the coronavirus pandemic. As you're aware, the pandemic has changed everything in this world. It's taken a toll on medicine in general, and unfortunately there are people with delayed treatments, delayed surgeries in many fields of medicine that are heartbreaking. It's horrible collateral damage to a widespread problem. Treatment in our clinic has been affected, but due to some new changes in policies and procedures, we are now very effectively delivering care despite the pandemic. One thing you'll notice right off the bat is that patients need to come in by themselves. You can't bring family members at this time. People are waiting out in their cars. We're calling them. We're calling you outside so that people come in one at a time. No longer are you waiting in the waiting room. We're avoiding contact with other patients. We're minimizing exposures wherever we can, and this should be very safe. Obviously, people have to wear masks. We're all masked up as well, and seems to be working very well. There are some delays due to our sterilizing the rooms, so turnover is a little slower, but we are delivering care fairly quickly despite these changes. You might notice that half of our staff is gone. They're working from home remotely, and there may be some delays in phone calls because you're speaking to someone at home and they're conveying the information to the office. But in this way, we only have half the staff exposed at any one time, and should someone have an infection or exposure, we have a whole second team to fill in for the office. It's not quite as warm and fuzzy as it used to be. I'm no longer spending time with couples when you're first coming in, but we are giving effective care. Now, there are some backlogs in surgery. Last spring, they shut us down for about 10 weeks, and we're still working on the surgical backlog. There has been no let-up in demand for surgeries or other procedures, and we're working as fast as we can, as diligently as we can. So please understand that surgeries are a few weeks in arrears. You might wonder, am I crazy for wanting to get pregnant during this time of the pandemic? Well, you're not alone. We're seeing a significant uptick in interest for treatment. This isn't logical, but it is human nature. You're at home right now. What else are you going to do? Right now might be a good time to try to get pregnant. You need to realize there is perhaps never a good time to get pregnant. There are always risks associated with pregnancy. There's always uncertainty in life. But by keeping risks low, seeking treatment is a very reasonable decision. Realize that there is light on the horizon at the end of the tunnel here with the vaccine coming. So hopefully in several months we will be vaccinated, and this pandemic will be in the rear view mirror. But realize other pandemics may be coming, other diseases may be coming, other pandemics, unfortunately. So if you're looking for a perfect risk-free time to get pregnant, there may never be one. There's always going to be uncertainty, and all we can do is the next right thing and do so intelligently. Now, there is concern about the COVID-19 virus and its possible effect on pregnancy and on a fetus in particular. A year or two ago, we had a Zika virus pandemic, and there were well-documented fetal abnormalities, and it was very, very serious. Fortunately, knock on wood, we're not seeing fetal anomalies during this pandemic. There are some cases where newborns were infected. There's some cases where they may have been born a little small or a little prematurely, but so far we see no severe birth defects, which is very reassuring. The COVID virus gets into our bodies through something called an ACE2 receptor in our lungs. Fortunately, the fetus does not have many of these receptors, so even if a mother were to be infected with this new novel coronavirus, theoretically there's also very little risk of a fetal abnormality. So, during this time of uncertainty, there are a few things that are always true. One, information is power. If you're curious, if you have questions, if you want to know something about fertility treatment, do not delay. Information is power. Also, time is never on your side. The sooner you get information, the sooner you get answers, the sooner you can make treatment decisions. Like I mentioned, there are some backlogs with some procedures and some surgeries. So the sooner you find out that you might need it, the sooner you can get in line, the sooner you can get your procedure done. So delaying as far as inquiries go or coming to visit us makes absolutely no sense. Do not delay. A final request. We've had to make some changes in policies. Like I mentioned earlier, it's not as warm and fuzzy as it used to be. There are some inherent delays in our treatments, and I ask that you please give us some understanding that we're working in very difficult times. We're all doing our best. Everyone's under stress right now, but with growing experience, teamwork, and camaraderie, we are effectively dealing with this pandemic and moving forward. Our care is excellent. Our success rates continue to be simply spectacular, and I'm very, very proud of this. I'm proud of Missouri Fertility. I'm proud of our team, and I have tremendous warm feelings for all our patients who've been understanding during this difficult time. I hope you found that helpful. It's Dr. Wilshire, Missouri Fertility. I look forward to seeing you.